thanks so much for watching Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and today we are welcomed by Dr. Robert Pearl, who we have had the pleasure of talking to before and are excited to talk to again today. He is a professor at the Stanford University Schools of Medicine and Business, author of 3 books, including ChatGPT MD, which is what we'll be talking about today, and the former CEO of the Permanente Medical Group. Thank you so much for being here.
My pleasure. Thank you so much for having me.
We are really just fascinated to talk about this new book because you actually co-authored it with ChatGPT, which I'm not sure of anyone else who has done that. So if you're the first, that's pretty amazing. But you trained it by putting 1.2 million words into ChatGPT and then used it as the co-author. And you said you went back and forth. What in the world prompted you to do this?
Last fall, I realized that generative AI, I call it ChatGPT just because I like the initials, ChatGPT MD, the name of the book that will be published next Tuesday, with all profits going to Doctors Without Borders. And anyone who buys it on the first day, I'll make an additional donation to this wonderful global relief charity. I realized how fast the generative AI world was evolving. And the typical book publishing process, I had done 2 books before, takes about 2 years. Takes the time period to write the book, but then a lot of time to re-edit it, to print it, to distribute it. And I knew that I needed something faster because by 2 years from now, it would be outdated. This technology is evolving so fast. It's what's called exponential growth. It's doubling in power every year. That means in 5 years, it's 30 times as powerful. Almost anything that I wrote would have been a failure. And so I turned to ChatGPT. I said, if this can change medicine, it should certainly be able to impact the speed of processing of books. And fortunately, although as you note, it took me a lot of work, it did that in about 6 months. I was able to write a book of the same quality. Again, calling it a co-author is a little bit unusual because I gave it my voice, my information, but it facilitated the process radically, and hopefully readers will enjoy. I did keep 1 chapter or 1.5 chapters that ChatGPT wrote alone that I didn't edit, just so people could see what it would do. But most of the material was combined back and forth, but in my voice and in my understanding and leadership.
It was really fascinating, Robert, to read this book and to get a preview, so to speak. It's very exciting to have that book in our hands a bit before it's released so we can even understand what this is about. It was intriguing to see some of the back and forth between you and ChatGPT, not to anthropomorphize it as you were saying, but it really did feel like, in many places, a great collaboration. In the book itself, you talk a lot about how you're thinking this is going to change the paradigm for the physician, change the paradigm for the patient, and actually really change the paradigm for them together. So I'd love for you to help our listeners understand why you think this is really something different than other technology, and what are those paradigms you're talking about?
The biggest paradigm is that medical care in the United States today is very episodic. You have a problem, you go to the physician, you get advice, and you I'll say go to the clinician, because sometimes it's not a physician, but the providers of the care. And the entire interaction is driven by that one experience. And if you have a chronic disease, and remember, 60% of Americans have chronic disease. Today, we're talking about diabetes, hypertension, asthma. Maybe you go 3 or 4 times a year, and in between, nothing happens. What this technology allows is it allows, and I call it an empowered patient. Today, if you go to Google and you click on a link, you get a lot of information. There's not much you can do with it. If you have a question about it, there's no one you can ask. That's about to change with a generative AI ChatGPT solution. Now, patients have expertise. They can put in symptoms, they can put in their history, their medications, and they can get medical answers. With chronic disease, they can wear monitors wearable devices that provide information into the application, and every day they can know how they're doing. All the disparate parts of their healthcare, prevention, acute disease, chronic disease, now become integrated on a continuous basis. And that is a unique opportunity that hasn't really existed before. It's a tremendous breakthrough. Now, I want to be clear to listeners and viewers, I'm not talking about the application that's here today. That's not yet ready to be turned loose. Everything, all the information off of it needs to be double checked with a clinician. But it's growing, it's increasing in power, doubling every year. And that means that 5 years from now, it'll be 30 times as powerful as today. Think about that. If your car were 30 times as fast, or an airplane, you'd say, that's impossible. And it is impossible with a car or an airplane, but not with a computer application. And right now, if anything, it's moving faster than I thought when I began the book, which gives me the optimism that we're only a short couple of years away from generative AI becoming central to the practice of American medicine.
That was a fascinating distinction that you made in the book, that with Google, you can go on, you can put your symptoms, but it's not providing the expertise. You have to go then search through, but AI is able to do that on your behalf and really give you something to go for. But is there a world that where at some point, what if you couldn't trust it? What if somebody trains it with misinformation intentionally? I mean, that seems ridiculous, because who would want to spend that time doing that? But people do nefarious things. So can you trust this in a world when this is so powerful, 10 years down the road? Can this be something that you can truly trust and go to a doctor? Or is that something that they're going to have to go back and go, oh my God, that's totally different than this? Where does that line go?
Yeah, so let me give you two parts to it. The first one is that what a generative AI tool can do is personalize your care. Think about that. We all have DNA, our genomics, our genetics. How much about your DNA does your doctor know? Probably not very much, because it's so massive, the amount of information there. Maybe if you have a particular disease, the individual will recognize that. For ChatGPT, that amount of information on the human genome, it's not particularly hard to fully integrate. How about all of your medications? How about your comprehensive electronic record? All your lab data? This, again, is a massive amount of information that would overwhelm a single individual, but for this computer application, it's not. So we're not talking about the general advice, going back to the point you're making on a Google, where you get information on diabetes. Specifically for you, with your family history, with your genetics, with the medications, with the day-to-day wearable monitoring. Doctor wants to get an entire volume of blood glucose measurements, but for ChatGPT, that's not hard to do. And with what's called plugins, which are now actually labeled GPTs, physicians can enter information. So the clinician is directing the application about your diabetes and what's expected, and wants to know both what you can do to improve it, the direction you should be going, and when to notify the clinician. So that is completely unique away from Google. To the point you're making, though, about, I'll call it, bad actors, what I stress in the book, ChatGPT MD, is we shouldn't be holding this technology against an absolute standard of no problems. We need to put it into the context of two things. How does it compare to the technology that people are using right now? If they're going to Google and clicking on links, is the amount of misinformation on a generative AI more or less than they're likely to encounter? And the answer is it's far less. Why is that? Because it's easier to post an article or a link. We see it every single day on Google. ChatGPT, on the other hand, includes all of the information. And so data that deviates from reputable sources, peer-reviewed medical journals, as an example, that is going to be picked up by the system and minimized. It doesn't get rid of the risk. It just makes it actually less that happens today. So I'm concerned. I write in the book an entire part, one of 5 parts, on the difficulties around privacy, security, bias, misinformation, but I'm optimistic that it will actually improve where we are now, not undermine it.
So, Robert, what you're describing is almost mind-blowing because, with every point you made, I'm thinking my mind is going in so many different directions. So it's exciting, but at the same time, it runs the risk of feeling overwhelming to, I'm sure, practitioners as well as even to patients who might be thinking, where does this begin? I guess one of the points you were making, because we're only going to be able to follow a thread at a time, is it almost sounds like each individual has to train the model that they're using with their data. Is that what you mean? Like when it comes down to it, am I going to have to feed all my medical history information, even DNA information and personality information and all of that into the engine so that it actually understands who I am?
The more the application can know about you, the better the answers are going to be. Think about going to a doctor. If you walk into a doctor and you say, I'm coughing, what's my diagnosis? The likelihood is they will have a shot at guessing it, but it'll be a guess. What do? They take a history. All right, tell me about prior diseases. Tell me about your family history. Are you a smoker? These are the kinds of questions that allow a clinician to make a diagnosis. And so the answer would be yes. Now, today, and I talk about in the book how labor intensive it was to put in the 1.2 million words. So today it's not as easy as it needs to be, although it's becoming easier very quickly. And recently, what's called memory has been introduced. So now it can remember from time to time. So yes, I think there will be a training that has to happen, tools that will become available, but these will not be impossible. They'll be essentially the equivalent of what a doctor would say. The application might say, have you had a genetic test? Where was it done? Do I have your approval to get that information included into your record? Again, I want to stress this exponential growth. You can look at what exists today, or you can say, at the rate that it's improving, what's it going to be like in 2 years? And I think in 2 years from now, it's going to be very simple to enter a lot of this information. And as I said, these GPTs that can be created by your doctor may do a lot of it for you. But I also want to, again, stress the problems that exist right now. We don't have comprehensive medical records. We don't have what's called interoperability. 400,000 Americans die every year from misdiagnoses, 250,000 from medical errors. We do a poor job of taking care of chronic disease, diabetes, that impacts about a third of the population, either impacts it right now or is pre-diabetes. We control it, and you know this very well, less than half of the time. Hypertension, the number one cause of strokes and a major contributor to kidney failure and heart disease. We control that about 55 to 60% of the time. Our performance today is not what it needs to be, and it's not because we don't have great clinicians, and it's not because they don't work really hard and they're being very dedicated. It's that we haven't had the tools to take care of these problems that are not intermittent but happen all the time. And what's exciting to me is that generative AI creates that opportunity. And what it's going to allow is to shift the doctor-patient relationship from being episodic to continuous. No doctor has the time to do it 24/7, but the technology on behalf of the clinician can accomplish it. And it has the opportunity now to focus on health. It's far better to prevent a heart attack than simply to reverse it. It's far better to avoid a cancer than simply to treat it and cure it. This is the real holy grail of medicine. And now we have a technology that, when combined with a powerful doctor-patient relationship, can accomplish this goal.
As Apoorv said, there are so many things that you come away from each answer with 50 new questions. And I will just say there were a couple points, I loved in the book that you were saying that the issues that we have in the medical system are not necessarily because we don't have the expertise. It's not because we don't have people who are smart or willing. We have those things. So I really liked how you showed how this can fill that gap. You also talked in the book about how this is not a threat to doctors and taking jobs because there's a shortage. So again, this is an augmentation, not a threat. And it's something that people need to embrace. And then to your point that you were just making now, it does sound like this has to be a collaborative point between doctors and patients, and that it's going to enhance the actual human relationships. And tagging on to sort of what Apoorv was saying, yeah, was sort of asking a question that I had too. Who is using this? The patients are using it, but it sounds like it's coming from the direction of the doctor. So either maybe they're getting, you said it, a plugin, maybe they're getting something that has the pre-population with their EHR in that and their information. So it's not like it's laborious for the patient to sit there and go, oh, I have all this. The doctor may be able to direct some of that and say, here's this, or here's this access code that you can go in, and then it has that and you can provide additional information. If that's the case, then are we understanding this properly? And how do you see that enhancing the participatory relationships between doctors and patients?
I'd like to make 2 points about it. First, the specific applications, but secondly, the things that will be necessary to accomplish it. For the specific applications, everyone is good. Well, it's already started using it, by the way. I hear every day from clinicians. It's interesting. They know the book is coming out. They haven't read it. You had a chance to pre-read it, but most have not. And they say, do you realize, Robbie, that this can make diagnoses accurately? I just pretended to be a patient of mine. I put data into the system, and the answer I got was exactly what I would have told the patient had they come to the office. So the opportunity to use it is going to be there for both doctors and patients. For physicians, remember the medical knowledge is doubling every 74 days. No one can keep track of it. Computer application like this, not a big problem. So the opportunity to use clinicians. I tell in the book a story about a surgeon in the operating room who saw a problem that she had never seen before. And the standard treatment would have been very hard on the patient and left long-term consequences. But immediately, she was able to find a case report that was identical and knew that 30 minutes from now, things would be good if she could just wait in the operating room for the patient's anesthesia to reverse itself. So the opportunity for clinicians to find obscure diagnoses, to have second opinions on the ones I said earlier. 400,000 people die from misdiagnosis. Another 400,000 people are crippled as a consequence of that. These are opportunities that the technology will have for the clinician. For the patient, it's going to provide expertise, not just knowledge, but expertise. So that the clinician, the patient that, let's just say it's midnight, your child wakes up with 102.5 fever. What should you do? Do you go to the ER, where you're going to probably wait an hour, be surrounded by people coughing, many of whom might have COVID during the pandemic? Or do you wait till the morning for the pediatrician to arrive in the office? Maybe a terrible thing will happen across the night. You now can get expertise. Will it be a perfect answer? Probably not. But today, what exists is far, far from perfect, far better than what exists right now. So those are the 2 ways they can individually use it. But I think more importantly is the way they can, I'll call it, symbiotically use it, which is that if you look at the fundamental problem that doctors have today, by the way, as you well know, 60% of clinicians are burned out today. It's because they don't have time. The demands are so much more than they can able to accomplish that at the end of the day, they go home feeling exhausted and not feeling great about the fact that they didn't do everything that they could have that day on behalf of their patients because they didn't have time. We're talking about 17 minutes per visit on average in the United States today. I believe that generative AI can allow patients to do 20% of what clinicians do today, to better manage chronic disease, to be able to answer their questions. And when the patient goes to the doctor's office, they'll already have background. They can ask better questions. They can better understand. We know that often people go home not being sure what the physician said. Now we have a tool that will allow that to happen. I think it will augment that relationship. And when what's needed is a visit to a doctor's office, the clinician will now have more time to spend, able to go deeper into the issues, not just prescribe a medication or do what seems obvious but may not be the optimal solution for this particular individual. I think it will augment the doctor-patient relationship. not undermine it.
That is really, again, another fascinating issue to explore. And Robert, as I was listening to you, again, my mind was thinking in terms of augmenting the relationship. I think I totally agree with you. I think this is a very promising technology. At the same time, what I was thinking is that part of the doctor-patient relationship is about the one-to-one connection, which creates some element of responsibility, you could say accountability, and obviously there's the liability, concept that is really embedded inside the medical world, where we think, okay, if something does go wrong, then I always have a particular individual I can go back to query or even unfortunately prosecute. So what happens in this case if expertise is available outside of a human individual, and I've got my own personal, ChatGPT MD that I've trained, and something goes wrong? Do I then lose that recourse, or do you think that that element is not going to turn out to be as critical for augmenting the relationship?
I look at it through the lens of the patient, which is how do I maximize the quality of care, the clinical outcomes, the health of the individual. I mean, I hate to say this, you and I are both physicians. Problems happen. It's just the nature of medicine. Some things are not 100% definitive. The question to me is, can I improve it? Can I make mistakes or create errors or have bad outcomes less often, less severe? And just about everything that I see about this technology, again, not what exists now. What exists now, patients should be using for background, but then consulting a human, a clinician, for definitive answers. But in the future, I see it as being better because I see all the problems today. I see people with chronic disease who are going blind, losing extremities, kidney failure from diabetes. Again, we both know what exists in medicine today, and it's not what it needs to be and what it could be. So I look at it from the more positive side that's there. Uh, Clinicians tell patients what to do. Do patients always understand it? Do they always remember it? No. And when they don't do it, whose fault is it? Well, we can debate that. And as you point out, there's also a legal system that unfortunately often gets in the middle of what should have been a health-focused decision. Instead, it becomes a legal question. That's going to continue to exist. But I think that what will happen, I'm hoping, is that patients will better understand what the doctor said, be better able to translate it into practice, won't have to wait 3 or 4 months to find out that they need a different dose of insulin or a different regime. And they'll avoid the hypoglycemia where they all pass out and have a car accident, or the hyperglycemia, in which case they'll damage their blood vessels and the nerves to their extremities. This is the opportunity that exists. And so when I put it into the context of, will patients have better clinical outcomes? Will clinicians feel better about the outcomes they can help patients to achieve? I look at this and say it's a very powerful tool. And if we don't take advantage of it, we will miss a great opportunity. We made mistakes. In the book, I talk about healthcare 1.0 through 2.0, 3.0, and 4.0. 1.0 was the advances that happened in the end of the 20th century. These were major: CT, MRI, ultrasounds, transplants, heart surgery. We can go down the whole list of advances, an understanding of how to prevent cardiovascular disease with drugs that can accomplish that. Then we got into 2.0. This is the electronic health record. I'd say it was a moderate failure. Information's not available. It didn't address the chronic disease problem. Why was that? It was created and used for financial purposes, billing and claims. Then we get to the, I'll say, the aught years, the second decade of the 21st century. Now we have technology that would allow people to manage their health the same way they do travel through Expedia, or their finances, or all the other ways they get retail information, and we paid no attention to it. We didn't use it. And the reason I believe is that we failed to translate a technology into a way that didn't sap the energy of doctors and take time away from them, and also didn't undermine income. And that may sound a little I don't know, monetary to listeners and viewers. It's just the reality. Doctors need to earn their living the same way everyone else does. And a technology that erodes that isn't going to be embraced in the way that it needs to be. In Healthcare 4.0, the generative AI era, I see the possibility of being able to reduce the demands on the clinician and preserve the income by increasing the health of patients. Imagine what it would be like if we had a third fewer heart attacks and strokes and cancer. And that's been demonstrated by organizations, and they've done it with a lot of technology and a lot of people. Now we have a tool that can be done universally. So I'm optimistic around all of that. But again, it will come down to whether the clinicians are willing to use it to help patients and whether patients are willing to embrace it and apply it into their medical lives.
It definitely seems like something that they're going to have to embrace, whether begrudgingly or not, because you can't exist in this world without it at some point. Going back to the relationship too, I told you a story before the interview started that I had to use one of the online services where, a doctor pops up right away. And then you talk to them and it was not through my health system. And they had no context about the situation or about me. And it was this very generic and scary advice. And ultimately, we still went to the emergency room. So it really didn't do anything to alleviate the fear. It made it worse. And then we were sitting in that. It was during COVID. And what ended up happening is I texted my daughter's NICU nurse, or one of our who has become a friend. And I said, what do I do? And she goes, get out of that emergency room. She said, those people are sick. Get out of there. I know this kid. I'm telling you, here's what happened. You're good. And that was far more valuable than having this person who doesn't know me just pop up. And it was kind of like an, on demand thing that ultimately was useless. And I hate to say that, but it's true. And so with that, when you were talking through all of this, it really seems like being able to have this access, have these doctors embracing this and have better information. And as you even said in your book, remove bias for things that you think, oh, I know that what that is immediately. It may not be. Being able to have these access points to the newest data, to the latest drug information, to clinical trials, everything that they can have at their fingertips now that ChatGPT and other systems can just make together. I can't think of the word right now. It's escaping me. But really, just put everything together for everybody. I think will form better relationships with patients and doctors because they're not going to just seek these arbitrary things like I had to that night. They're going to say, I know that my doctor has access to this. They believe in this. They're working with the best information. And I'm also able to see that and validate that. And I think that's going to enhance the trust with those relationships. Do you agree with that? That it's just going to be a great way. At the same time, I also think there probably have to be ethical guardrails.
You've really raised a crucial point. And I'd have listeners and viewers ask themselves the following. How often do you have a medical question, medical concern for which you would like information? Now, if it never pops up, I don't know that you're going to find ChatGPT particularly useful. But I have problems and I have questions, and I'm a clinician, I'm a physician. It's just outside of my particular specialty, and I want information. Now, I can go onto Google and I can find it because I have the medical background, but most people can't and can't do it accurately. So what happens if we could answer those questions? I mean, think about even your situation when you went to the ER with your daughter. You know, how could you have gotten that information? How could you have received that information without having to be there and in panic calling a friend because you happen to have a friend from a NICU experience in the past? I don't know if she was seen at all. If she was seen, imagine the wasted time. What could that clinician have been
doing? It was
doing?
4 hours to triage.
Yeah. What was the cost of providing all of that? I mean, you start to look at the questions, you say, this is ridiculous. We need the ability to help patients to be able to accomplish things. But as you also explained, if you go to just, I'll call it a teledoc transactional service, either they don't have the information to give you the background you need, or they're just going to give you the conservative answer, go to the ER, because it has no choice. It doesn't know you, it never saw you before, it will never interact again. This type of application, once you downloaded the information about your daughter, once you've put into place the kind of care you'd like to get, you now can start to sort things out, to divide it into pieces. Yes, she's almost going to be fine. Here. By the way, it probably would have asked you a bunch of questions that would have made the right diagnosis. And because the problem she had has probably been had by tens of thousands of girls across time. And
Yes,
so
a
there's
grandparent giving her too much sugar. Yes, they have.
exactly. So I would ask, has your daughter been to the grandparents recently? What did she eat? Is it possible this relates to that? And she might even ask the question simply because it could be food poisoning. It could have been a lot of things that would have been serious. So this whole process, it's the way that doctors make diagnoses. And we learn what's called algorithms. I ask a question, and if I get a yes, I ask a certain question. If I get a no, I ask a different question. That is exactly how these type of generative AI tools are able to approach a problem. And in the end, by the way, it might have told you it's really serious, and you better call 911, and you would not have known that either. So that's why I say it's not that it's going to give you perfection. That's not possible in medicine, but it should be able to do far better than we can accomplish today. And if you think about it, when are your clinicians available to you? A third of the time, Monday to Friday, usually 8 o'clock to 6 p.m., evenings, nights, weekends, you're almost on your own. And so when I put those pieces together as a patient, I want to be able to get this information. And by the way, I often use it myself now. I double check it as a clinician. And that's what I'm going to be encouraging listeners and viewers to do. Start using the tool. I'll say in quotes, playing with the tool. Put the information in, ask the questions, become more educated. And what you're going to see is that the more times you go back, as you and I discussed, I had to do it hundreds of times in writing this book with the application and say, give me a more sophisticated, a simpler to understand answer. Give me a probability. You can ask almost any question and get information. Not yet ready for action, but it will be in the future, and learning how to do that. And by the way, it's been estimated by researchers, it takes about 10 hours of practice for the patient to become really good at using these tools.
Well, that may be good news and bad news because I'm going to test this because my husband has a shoulder injury from a ski incident. So I was like,
Okay.
I'm going to use this to help him. But
Yep.
10 hours, I may be sending him to the wrong place. So this may be bad news for my husband to be the guinea pig.
Yeah, I think that's great. I'd love to hear the follow-up of that. Robert, the more questions you answered for us, the more questions you've raised. This is just an incredible interview, really learning so much. I can't believe how far ahead you're getting us to think on the basis of all these, the way in which you've been analyzing and studying this process. So really, thank you for creating this work. Thank you for coming on our show and for educating us. I think my final question is a little bit more along the lines of what you were already starting to say. If you can be a little bit more, let's say, one, two, three, for the average user, let's say a patient is listening to this, what exactly do you think they should start trying out? Is there a particular type of engine they should go to? Is that engine already starting to learn about who they are based on what their interactions are? What kinds of things should they test out? So maybe if you could dig a little bit deeper into your guidance for today for the average listener.
Well, the first thing I would say is that they should buy ChatGPT MD this coming Tuesday, which is April the 9th, with all profits going to Doctors Without Borders. And anyone who buys it that day, I'll make an additional donation to this very worthy charity on their behalf. And that will give them the background that they need. The second thing is they need to use an application. There's a bunch of them out there. The one that I used was GPT-4. GPT-5 will be coming out. It'll be a lot better. But they all have great advantages, whether it's the one from Google called Gemini or other ones that are available right now. But they should be able to obtain one. And some of them, by the way, are free, although they're not as powerful as the ones that you have a subscription to. And start to use it. See how it works. Put in as much information as you can and start to learn the prompts, which is how do you ask the right questions? You say, tell me about diabetes. You're going to get a very generic answer. You tell them, I have diabetes and I have an ulcer on my foot and it's red and it's getting worse, what should I do? You're going to get the right information that you're on your way to a major disaster and you need to see a physician today. Maybe get revascularization of the leg, maybe get a change in insulin, different things, or antibiotics, a lot of things that could be done for your problem, but you're going to get the right information. And then, as I said earlier, make sure you double check whatever you get with a clinician today, only because the application needs to double or quadruple in power before it's going to be as accurate and as consistent as we need it to be. I would also say to readers to think back of what's going on. Right now, half of Americans can't afford healthcare. Right now, the quality outcomes we get lags the other 12 most industrialized nations in the world. Even though we spend over $13,000 per American on healthcare, Switzerland spends around 10, Germany 8, everyone half of what we spend. As I said earlier, we control diabetes and hypertension, very important medical conditions, very poorly compared to what's possible. I could go down the long list because I imagine that for some listeners and viewers, everything I've said today is a little scary. Wow, I'm going to be responsible. I got to learn all these things. And my answer is what exists right now is not what you desire. It's not as optimal as it needs to be. And once you start to realize that, I think that generates the courage, it generates the willingness, the ability to say, let me try something new. When the cell phone came out, people were afraid of it. They put it in their trunk in case they got into an accident, and no one would work today, live today without having a cell phone. This is the cell phone of the future, if you were to think about it that way. All the things that we do with it right now, whether it's in the retail world, the financial world, the travel world, it wasn't imagined back first when it came out, but the potential was there. That is where we are right now. ChatGPT MD will help you understand what's possible, what you need to do today, and what the future is and how bright it will be in a couple of years. And I welcome feedback from folks about their use around it. I want to know about how your husband does, the diagnosis that was made, how accurate it was, and so I can always learn and update other people as well. Thank you for having me on the show today.
Thank you so much for being here. This was fantastic. We learned so much and also could talk to you for about 10 more hours.
Indeed. Thank you. Really a pleasure.
And thank you all for watching. We'll talk to you soon. Bye-bye.